This lecture will be about the optimization of ultrasound parameters. I will try to cover transducer selection, preset selection, gain and focus adjustments, contrast parameters, and the others. The transducers may be convex, microconvex, linear, dedicated vascular, endocavitary, laparoscopic, or intraoperative. Convex transducers are one of the most commonly used transducers with low frequencies, deep penetration, and large field of view. They are commonly used in abdomen and pelvis. These are the two examples of convex transducers. Microconvex transducers have small footprints and provide a large field through small areas. They have deep penetration and large field of view. The common uses are transfontanal, suprasternal, or intercostal areas. Linear transducer is another commonly used transducer with linear array and rectangular field of view. They have high frequency and they have high resolution and low penetration because of this. They are used in superficial tissues like thyroid, testis, MSK, pediatric abdomen, or bowel. Here are the two examples with linear transducer. This is the detail of the testis, and you see the lymph nodes of the neck. Sector transducers have small footprint, square or rectangular in shape. They allow a sector image through small areas. They are preferred in echocardiography and transcranial ultrasound or Doppler imaging. Vascular transducers are dedicated to the vessel imaging with high to medium frequency, and the presets are adjusted for Doppler priority. Endocavitary transducers may be curvilinear or circumferential. Here are the examples. This is the circumferential. You see the rectum tumor, and we can evaluate the rectum circumferentially. This is a transrectal image of the prostate, and this is the transvaginal examination of the uterus. You see the details. Surgical transducers may be laparoscopic or intraoperative, dedicated with different shapes. This is an example of laparoscopic transducer use. You see the endophytic tumor of the kidney, which cannot be seen during the operation. By laparoscopic transducer, the lesion may be delineated for the surgery. This is an example of intraoperative liver tumor here, and I'm searching for the additional lesion. The existence of additional lesion will change the surgical approach, so intraoperative ultrasound is a gold standard in these patients. 3D or 4D transducers are volume transducers commonly used in obstetrics or 3D vascular investigations. For an optimal imaging, we need to decide the best transducer and frequency according to the target tissue, organ system, or body area we are interested in. The depth of penetration, tissue composition, and sound wave transmission are important to decide the transducer type or frequency. Here is the example of the thyroid gland. You see the tiny cystic nodules with linear transducer, but you can see that all the gland lobe could not be covered, and we cannot measure the longitudinal distance. So in these cases, we prefer to change the transducer to the convex one. You can measure all the distance, but you see the loss of detail. This is another example, an adnexal mass in a woman, a mass here, But when we use the transvaginal transducer with high frequencies, we can see the better delineation of two lesions and the content of the lesions. Presets are optimized for high-quality imaging. They are specified for body parts or the tissues in the same body parts, and for various steps. You can see preset differences for the same transducer. Now they are flexible enough to change up to your preferences and save as your personal presets. These are two examples of the same transducer with different presets. Bowel presets is decided to evaluate the deeper tissues, but not suitable for anterior wall of the carotid artery. This is an example of acute appendicitis seen by general abdomen convex transducer. But when we move to pediatric abdomen and linear transducer, we can better demonstrate the appendicitis. When we move more superficial presets like testicular or thyroid, we can better delineate the appendicitis, including the walls and the lumen. We should be flexible enough to change the transducers and presets during each imaging. The loss in amplitude of sound is compensated by gain, and gain determines the brightness. These are the examples from my own thyroid. This is an optimal brightness level. This brightness level is lower than normal to evaluate the detail. Or this is very bright, we can lose the details. So we need to optimize the brightness in each imaging. The focal zone determines the depth of the most homogeneous sound beam and also the dimensions of the near field and the far field. Focusing should be adjusted at the level of body area or tissue that's most to be interested. This is an example of focal zone use. If we are interested in the thyroid, the focus is in the wrong place because it's preferred to the superficial tissues, or this is another wrong example for the thyroid. But if we are interested in the deep tissues, of course, the focus should be in the deeper areas. This is another example. The same transducer, but with superficial presets. You see the loss of detail of the thyroid, but the muscles and the layers of the skin and subcutaneous tissue are better delineated. This is a more superficial transducer use. You see the loss of thyroid details, but the skin, subcutaneous fat, and the detail of the muscles. We should decide the level that we are interested. Here is the example for the convex transducer. You see the focus is here and the loss of deeper details. This is more medium level, and this is for deeper focal zone use. And you see the superficial layers are lost. So we need to optimize the focus that we are interested. Broadband transducers allow frequency change, penetration versus resolution. The patient has hepatosteatosis. All the other parameters are the same, but only the resolution, general or penetration preferences are changed. So you see the detail here, but loss of deeper tissues. You see the penetration demonstrates deeper levels, but the resolution is not as good as like that. Contrast is the other parameter that should be optimized by using dynamic range, gray map selections, focus on rarely chromatic imaging. Dynamic range affects the contrast. You see, low dynamic range means high contrast, more black and white image. High dynamic range, the gray shades approach to each other and the contrast is lost. So high, not low dynamic range, but an optimal one for an optimal contrast. This is another extreme example from the abdomen. You see very low, all the details are lost. This is high, and this is the optimal example. This is the example of gray map use. Remember from the previous lesson, more white shades and two different gray shade preferences. And for the convex transducer, 3 different maps. It's up to user's choice. Chromatic image may be used instead of gray shades. We can use blue shades or green one. By decreasing the sector width, lateral resolution increases, contrast increases. As the frame rate increases, temporal resolution increases. This is the sector width narrowed, better image and compared to these ones. You remember from the last lesson some additional methods that increase the sound quality. I have some examples. In that example only, speckle reducing algorithm is on. You see the calcification and acoustic shadowing. In that example, compound is on, the harmonic is not. You see the same classification, and the shadow has a wider appearance because of the multi-angle use of sound waves during compound imaging. And when harmonic is also on, you see the resolution increases, but the penetration of the sound beam or the signal decreases. In that example, nothing is on. You see the gallbladders. These are side lobe artifacts, reverberation artifacts here. This is almost a nude image. When compound is on, you see better image, some loss of artifacts, but reverberation is still here. When compound and harmonic both are on, you see the side lobe artifacts are eliminated, reverberation artifacts are eliminated. This is another example. This is a nude image. There's only speckle reducing, speckle plus compound, speckle, compound, and harmonic all are on, and this is the best image when compared with the others. Panoramic imaging or extended field of imaging is an older technology than the smart telephones for the ultrasound. The obtained image data is accumulated in a buffer during the movement of the transducer, and a large anatomic region can be visualized as a single image. Here is the example. This is the right rectus muscle. This is the left rectus muscles. This is the tear in the left rectus, linea alba, linea semilunaris, oblique muscles, and the deeper areas. Image optimization parameters are important for a good clinical practice. The next lecture will be about ultrasound artifacts. Thank you for listening.